Do I need double eyelid surgery revision?
Asian double eyelid surgery is a very popular procedure throughout the world. Approximately 50% of people of Asian descent are born without a defined eyelid crease, otherwise known as a double eyelid fold. The desire to have a double eyelid fold comes a lot from people wanting their eyes to appear more open. Interestingly, a significant percentage of people after having Asian eyelid surgery become intensely concerned about how their eyelids look within a short time after the procedure and look to have revision surgery. I'll discuss how I help people who come to us after having surgery performed elsewhere and are requesting revision surgery. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have focused a significant part of my work as an eyelid specialist on procedures for Asian eyes. I routinely perform all types of Asian double eyelid surgery using the incisional and non-incisional methods as well as epicanthoplasty as well as ptosis. I also perform revision Asian double eyelid procedures previously performed by other doctors. During the first few days to weeks after Asian double eyelid surgery, some people believe that their new double eyelid creases are too high. This is often followed by requests for revision surgery as soon as possible. An understanding of the phases of healing can make it easier to understand why revision surgery is not indicated in the first few weeks after surgery. In addition, there are particular aspects of Asian eyelid surgery which can result in swelling between the eyelid crease and the eyelid margin for a longer period of time in comparison to non-Asian eyelid surgery. Inflammation and circulation are responsible for swelling. The swelling can make the crease look much higher than the crease position actually is. Whether the surgery is non-incisional or incisional, a particularly important part of the surgery is the placement of sutures to connect the skin to the muscle which lifts the eyelid, called the levator muscle. In non-incisional surgery, small openings are made into the skin where sutures are placed to make this connection, which then results in the formation of a crease. With incisional surgery, a limited amount of skin is removed, as well as fat. The skin is closed with sutures which engage the levator muscle to form a crease. In general, I've observed there to be less swelling for less time with non-incisional surgery. The 6-month point after eyelid surgery is when eyelid appearance is more stable with minimal swelling, although in some situations swelling can persist for a year or even longer. If a revision procedure is needed, this is a time when revision surgery can be considered. Many people asking about revision surgery after Asian eyelid surgery are premature in their conclusion. Swelling creates the perception of the eyelid crease being too high. With this understanding, what would be an appropriate situation for surgical revision? The key principle of double eyelid surgery involves creating a connection between the muscle that lifts the eyelid, called the levator muscle, and the eyelid skin to create a crease. If the crease is not well formed, then a surgical revision can be considered. In many situations where the crease is not well developed after incisional surgery, I'll perform non-incisional blepharoplasty to create the connection between the levator muscle and the skin without having to reopen the eyelid as it was done in the original surgery. An issue which can occur with double eyelid surgery is that the eyelid incision is too long and extending beyond where the crease would appear naturally. In surgery involving the removal of eyelid skin and fat, it is possible that too much skin or too much fat to be removed. In cases where too much skin is removed, skin grafting would be necessary. If too much fat is removed, making the upper eyelids appear too hollow. This can be addressed oftentimes with precise placement of injectable cosmetic filler. As with primary surgery, I perform revision eyelid surgery with local anesthesia and light IV or intravenous sedation rather than general anesthesia, which makes recovery time quicker and more comfortable for the patient. After you have double eyelid surgery, whether it's incisional or non-incisional, the crease looking too high in the early phase of healing is generally normal. It's important to communicate with your doctor and see your doctor for scheduled post-operative visits. If revision surgery is indicated about 6 months or later after primary surgery, make sure you understand what will be done and what kind of recovery you can expect. I hope you found this information helpful. Thank you for your question.